Thank you very much, Andre. I now invite Dr. Joe Schwarcz to come and present the arguments for the opposition. Dr. Schwarcz, you have 25 minutes.
Luckily, when I was in high school, we had a choice in grade 9, believe it or not, either take Latin or math. I took Latin. So I'm very familiar with all of these principles, but eventually I decided that it was a pretty good idea to take math too, because statistics are important in science. In fact, so much relies on it. I don't have a stone that will kill many birds. We're going to take a bit of a different approach. I think we need to switch the... yeah. Okay. A little bit of a different approach from what you've heard. I'd like to, of course, present my views on what I think naturopathic medicine is and whither it should go. But first, just a bit of an introduction. Well, welcome to McGill for those of you who are here for the first time. I've lectured in this room many times, although to very different audiences. But for those of you who don't know, our office really is dedicated to demystifying science for the public. To keep people up to date on what is happening in the world of science, we try to foster critical thinking and hopefully separate sense from nonsense. That basically is our mandate. There is no conflict of interest. We do not accept any funding from any vested interest. We don't sell you anything. We have no money interest whatsoever. We worship at the altar of the scientific method. That's what we do. For those of you who are not familiar with the scientific method, it's pretty rigidly defined as your usual steps of going from hypothesis to conclusion. That's what we look at. We look for evidence, and we try to shine the light into the darkness based upon evidence. If not evidence, then what? I'm sure that's a question that comes up in your mind. I mean, what else would anyone base anything on? Well, there are other things. There's hearsay, there's wishful thinking, there are anecdotes, flim-flam. All of those come into play. One of the areas that I'm particularly interested in is the area of alternative medicine. First problem here is, how do you define this? Well, medicine either works or it doesn't. If it works, it isn't alternative. If it doesn't work, it isn't medicine. So what is alternative medicine? Well, the usual definition that I give it is that it is what we do not teach up the hill here, what we do not teach in medical school. That being said, and I have to negate that because both Mark and I give fourth-year medical courses here on alternative medicine. But by and large, I think this is a convention that we can abide by, that it's the stuff that isn't normally taught, not because it's wrong, but because there is not yet enough evidence to incorporate it into the curriculum. There are many modalities that originally started out as non-mainstream that eventually crossed the bridge, which we now teach. I mean, nobody argues against Helicobacter pylori as being a cause of ulcers. Of course, we used to argue against it. I used to argue against it because it didn't seem to make sense. But when the evidence was profound, we, of course, embraced it. Well, the stuff that we do not teach goes anywhere from the reasonable to the absurd. What do we mean? Reasonable. There are many herbal therapies that are reasonable. Certainly St. John's wort works for mild depression, although it's not nature's Prozac, as some would have us believe. Then there are questionable ones, the whole array of dietary supplements, some of which have some evidence, many don't. And then we have the absolute absurdities, such as crystal therapy, healing diseases using crystals. So we have the whole gamut of stuff. Question is, where does naturopathy enter this picture? The theme of naturopathy, as you already heard, is essentially vitalism. What does that mean? What is vitalism? Well, it's a doctrine that goes back, well, probably to the time of Hippocrates, which essentially maintains that there's something more to life than what can be explained by the laws of chemistry and the laws of physics, and that these can be corrected. That is, whatever internal energy has stopped flowing through the body can somehow be corrected by paying attention to natural means. Now, that idea in fact, was, believe it or not, embraced by chemistry. Jacob Berzelius, one of the greatest chemists of all time, in fact, he was the first one to name the elements, not all of them, but the ones that were known at that time. He believed in vitalism. He believed that living systems had something that could never be duplicated in the laboratory. A plant or an animal had something that could never be made in the lab. And any chemical that was made by a living organism could never be duplicated in the lab. That was vitalism. His original textbook on organic chemistry was based upon that idea. And then along came Friedrich Wöhler in 1828. An ugly man, but nevertheless, a brilliant one. Friedrich Wöhler took some ammonium cyanate, a clearly inorganic substance, a rock, a mineral, never had any life, heated it, converted it to urea. Urea, of course, is produced in urine, so it is obviously a natural and organic compound. He excitedly wrote to Berzelius, "I must tell you that I can prepare urea without requiring the kidney of an animal, either man or dog. I have witnessed the great tragedy of science, slaying of a beautiful hypothesis by an ugly fact." Well, we look for those ugly facts. In naturopathy, vitalism is still around. It is still the basis. And this is what is taught in schools of naturopathy. Now, unfortunately, in my view, there's not an all-encompassing system of diagnosis and treatment in naturopathy. It's all over the place. There are diagnostic methods which are sometimes reliable. You have your classic blood tests, fine. But there are also other things. Iridology, dowsing, swinging pendulums above people to diagnose their disease. Now, certainly not all naturopaths do that. I don't mean to suggest that. But because there's a wide spectrum of practitioners, you can find plenty who diagnose using any of these modalities. And then come the treatments. Again, a very, very broad spectrum, many of which are perfectly acceptable. And we accept them in science. In fact, we incorporate them into conventional medicine. I mean, diet, of course, is part and parcel of conventional science, but cupping is not, certainly. And some of the other things like magnetic healing and hydrotherapy are not, because we don't think that there's enough evidence for them. So there's a very, very large compendium of diagnostic methods and treatments. And certainly not all naturopaths practice this. I would hope that many of the better naturopaths would immediately cross out many of these. But the fact is that they are out there. I have 35 years of experience in this business of interacting with all kinds of alternative practitioners on every conceivable level, including sending some of our students incognito to naturopaths for diagnosis and to see what goes on there. So I'm not just speaking out of my hat. I'll give you a couple of examples. This particular lady believes in energy medicine, which is a term that is very, very commonly used in alternative areas. Well, what exactly does she do? We've documented this all. And here are the treatments. This is a naturopath, properly graduated and licensed. And there are all the things, including dental work, recommending removal of any filling that has mercury in it, because that is the root of all diseases, and including a parasite cleanse. So you see all the different things that are done. Here's another one. I won't mention the name because there's some litigation involved here. But here's a naturopathic doctor who, as you can see, practices all kinds of treatments for serious diseases like MS, cancer, etc. And he diagnoses by using a gizmo, which has no scientific validity whatsoever, to measure electrical currents in the mouth, and then harmonizes those currents with the same instrument. One of his patients tells us this. He was diagnosing her allergies in this particular way, which is not all that unusual in the hands of many alternative practitioners, whereby you hold a closed bottle of a substance in the hand, and then they do what is called applied kinesiology to test it, to see whether or not you're drained of your strength. Now, true, they do not teach all of these things at the Canadian College of Naturopathic Medicine, or at least I hope that they do not. This is our 1 4-year college in Canada. And you can look through the courses. Here's one of the courses that they teach. That's the curriculum. Now, it is true, as you heard, that the first 2 years are physiology, biochemistry, that. But they are not taught to the same extent as we teach them in this very room. You can take a look. Some of those courses are actually online, which is good, so that you can take a look. It is true that they do teach physiology, they do teach biochemistry. They do not teach it to the same level that is taught in, certainly at McGill's medical school. The college is not associated with any hospital at all. It's not associated with any of the learned societies, which universities are associated with. There's no residency requirement. Now, you know that in medical education, a doctor graduates after 4 years, and then there's residency. A physician is not allowed to do anything after just 4 years. It requires more training. And the truth is, that's where you really learn. You can ask our fresh graduates if they feel whether or not they are ready to take on patients. They will tell you that they are not. It is during residency, during the hospital experience, that you really learn how to treat people. That's what medicine is all about. So why do people go to alternative practitioners? There are several reasons. They spend a lot of time with the patient. There's no doubt. They will sit, they take medical histories, and they are, by and large, very caring people. Most physicians spend 7 minutes with a patient. It is not enough. But that's because of the environment that we have, both political and economic environment. We should have more doctors. It's a crime that we don't have enough family physicians in Quebec. It's an absolute crime. We need more. They need to spend more than 7 minutes. And they can certainly do an excellent job if they have more than 7 minutes. That's where we have to be more active. Certainly there's good advice that is offered by many naturopaths. When it comes to diet, diet is extremely important. And I'm a big supporter of that, if any of you have followed me. I mean, I support a vegetarian-oriented diet. I support the DASH diet for hypertension. No physician starts by giving a pill for hypertension. The first approach is always diet. Unfortunately, it doesn't fail.
Order, please. Order. Order. Please continue.
That is what we teach. Unfortunately, it usually does not work. Or at least it does not work to the same extent that one would like it to work. It doesn't. And then, of course, you go to the pills. Now, I'm interested in that water diet. I will certainly look into it to see just what evidence there is for that. Because if there is evidence, we should be teaching it. It's as simple as that, you know. So I'm just wondering, just where is this evidence? I will certainly look into it. So yes, I mean, diet, of course, is important. But what is really important is the hope that is given. There's a very strong connection between the body and the mind, and to give hope is absolutely critical. However, there are risks associated with naturopathy. I don't blame people at all who love their naturopaths, but there are some issues that I have. There are some dangers. Many of them recommend against vaccination. To me, that's a problem. The business about acid and alkaline foods, everything that I've read that was produced is scientifically incorrect. You cannot change the pH of the blood by that. You can change the pH of your urine. And then there's the whole detox business, which makes no scientific sense whatsoever. There are all kinds of detox systems that are out there, some of them absolutely ridiculous, such as the foot bath. Now notice that they are not recommending this for the common cold. It is for fatigue and allergies, digestion, arthritis problems, all this kind of stuff. Okay? This, I bought, the one that I have, I bought from a naturopath. Okay? $700 something. There's some very interesting chemistry that goes on there, which is why I bought it. I'd like to explain how that is. But it's not appropriate for now. But they claim that it cures disease. Then there are detox foot pads. There are cold sock therapies. Believe it or not, you take your socks and you dip them into ice water. I kid you not. There are the instructions, which I picked up from a naturopath's office. Step-by-step instructions in order to improve your immune system, okay? And then you wear the socks to bed at night following all those instructions, and of course your immune system should improve. Then there is therapeutic touch, where you don't actually touch the patient, but you just massage their aura or their energy field. But part and parcel, of course, of all naturopathic treatments is the herbal remedy. And obviously, this has legitimacy because many of our drugs originate from natural sources. But if someone suffers from congestive heart failure and they need digitalis, which comes from the foxglove plant, you don't go and tell them to graze in a patch of foxglove. The drug is isolated, it is purified, it is standardized so that you know exactly what dose is given. So herbal remedies do have legitimacy for sure. In terms of efficacy, some are effective, some are not. And some of the popular ones, like echinacea, if you look at the documented evidence, you find that it is very weak or non-existent. Interactions, certainly. St. John's wort that we talked about before interacts with cyclosporin, which is a medication that is used after transplants to suppress the immune system, a very serious interaction. Ginkgo biloba interacts with anticoagulants. Now, hopefully, this is taught in naturopathic schools so that they know about these interactions. One would hope that these things are taught. In terms of safety, well, depends on which herb you look at and what concentration. Numbers are important. Dosage is important. As Paracelsus told us 500 years ago in Latin, sola dosis facit venenum. Only the dose makes the poison, right? So you have to know both the toxicology and the therapeutic potential of these substances depending on the numbers. And there are a number of herbs out there that can be toxic in very low doses. Every one of these has been used in practice without paying attention, not enough attention, to the dosage. But the one that I really pick bones with is homeopathy. André wanted this to be totally a part of the second discussion, which I'm very happy to do the whole thing on homeopathy. But I'm not happy to have a talk on naturopathy without putting homeopathy in there, because you cannot separate this. It is taught in all naturopathic schools, and many naturopaths practice homeopathy. This was the brainchild of Samuel Hahnemann way back 200 years ago, and I'm sure many of you know the basic tenets of it. If you've read my last 3 columns in the Gazette, you should know. It is based on diluting a substance to such an extent that after you reach the so-called 12C concentration, there's not a single molecule of the original left. Well, that's interesting in terms of chemistry. Of course, in terms of biology, how can non-existent molecules do something? It's just water, we say. And indeed, the evidence certainly suggests that there's nothing here other than the placebo effect. But that's a very powerful effect. I don't demean that. 30 to 40% success rate is great. But it really doesn't matter what you're using, whether it's really a sugar pill or one that has had added to it a solution made from the liver of a duck. It doesn't matter. We're talking about oscillococin, one of the most widely popular homeopathic remedies for the cold and the common flu. It is made from the heart and the liver of a Muscovy duck. But even if you're an animal rights activist, you don't have to worry about this, because one duck is enough to satisfy the needs of the world for several years because of the extreme dilution effect. Why this should have anything to do with healing, that's a completely different story too, which we will certainly discuss in the next debate on homeopathy. But if you look at the label, you will find that it lists an active ingredient, even though there is not a single molecule of that ingredient in there. And this is the reason that we say it is nothing other than Obicalp. Read it backwards. Of course, it's just placebo. That's what it is. And that's the reason that the Center for Inquiry, together with a law firm in Ontario, has launched a lawsuit of $30 million against Shoppers Drug Mart and Boiron Laboratories because they are mislabeling this remedy. They are saying that there's something in there which is not correct. There's nothing in there. This is not the first time, of course, that this has been challenged in this way. CBC Marketplace did a wonderful show on homeopathy. You can check it out there. It's worthwhile taking a look at it. But even better than that was the Horizon program in Britain, because that was extremely scientific. This was a program in which they took on James Randi's challenge for the $1 million. They tried to prove that it was possible to scientifically determine the difference between a homeopathic solution and water, using the most sophisticated technology, calling in the biggest experts. They were unable to do that. They did not get the $1 million. That $1 million challenge is there. James Randi has it in an account, and I've spoken to him. He is quite up to the challenge that I'm going to propose right now, which is to take homeopathic remedies, a number of them, take off the label, put them into unlabeled bottles, and see whether or not anybody, by any means that they want, you can use biology, chemistry, physics, any instrumentation, anything, determine which label should go on which bottle. That is the challenge. $1 million is up for offing if that challenge can be met. If you take a look at a pill, any kind of a pill, a regular pill, not a homeopathic one, and you give that to a chemist and say, tell me, is that aspirin, is it Tylenol, is it a beta blocker, is it an antidepressant? It will not take long to determine that because we can quickly find the active ingredient. Why should homeopathic remedies not be held accountable to the same extent? So finally then, why is there this belief in alternative medicine? There are several reasons. The charisma of the practitioner. Most naturopaths are far more charismatic than most physicians. I think we will agree. I said most and most.
Time's up.
There's frustration with conventional medicine because conventional medicine, of course, cannot cure everything. And frustration will drive people to do anything, including desperate activities. There's a lack of understanding of the nature of disease. That many diseases are self-limiting, and they will go away no matter what you do. There's a lack of understanding of cause and effect. Some primitive tribes will assume that the crowing of a rooster makes the sun come up the next day. Well, that's an association. That's not cause and effect. Because some intervention is associated with some getting better, some remedy, doesn't mean that it is responsible. That needs further investigation. There's a lack of understanding of just how powerful the placebo effect is. It is the most powerful effect both in conventional medicine and in alternative medicine. And there's a lack of realization that some therapists will just say things that simply are not true. The fact that, your ear has certain points that correspond anatomically to parts of the body, there's just no evidence for that whatsoever. There's a lack of understanding on how unreliable anecdotal evidence is. No matter who says it, it is still anecdote. Whether it's a celebrity or not, it does not make science. The plural of anecdote is not data. There's a lack of appreciation that there are some alternative therapies that can be dangerous. There's no question about that. There are therapies that can be dangerous, just of course, there are therapies that can be dangerous in conventional medicine. So just because someone has gone through conventional training and is an MD, not an ND, does not mean that they are trustworthy in every area. Of course not. We know that there have been many, many more legal challenges against physicians than against naturopaths. No question about that. Because, of course, they deal with more complicated issues. They certainly have a history of making mistakes. It wasn't that long ago that physicians recommended to arthritis patients to go into mines for radon treatment. Wasn't that long ago. That goes back to the 40s or the 50s. It wasn't that long ago that physicians recommended, after a heart attack, 6 weeks of bed rest, or after cataract surgery, lying motionless with bags of sand around your head, because it seemed logical, it seemed common sense that if you muck about with the eye or the heart, you have to rest it. We now know that this is not so, because scientific medicine is self-correcting. We change. Homeopathy has not changed for 200 years. That's one of the main features of scientific medicine. Whenever evidence becomes available, and of course it has to be reliable evidence, we go for it. Medical doctors make silly statements too. You may have heard of Christian Northrup. Widely read. Karen completely cured herself of Lou Gehrig's disease by loving herself unconditionally for 15 minutes a day. We will leave alone what loving yourself unconditionally means. But one thing I can guarantee you, it does not cure Lou Gehrig's disease. And then, of course, in conventional medicine, we have the problem of way overprescription. No doubt about that. Drugs can cause a lot of problems. There are millions of hospitalizations every year from properly used drugs, never mind the improperly used ones. It's a question of risk and benefit. That's what it comes down to. Health is a jigsaw puzzle. Everyone can make contributions. Contrary to what you may believe, I am not against naturopathic medicine. I'm against some of the folly that is in naturopathic medicine. I think that there are many legitimate naturopathic practitioners who will not have their patients sit with their feet in that silly bath, who will not take a pendulum and diagnose disease, who are not into therapeutic touch, but who are into lifestyle changes and exercise and recommending diets and sitting down with the patient and comforting them and essentially acting as good psychologists. I'm not against that at all. I am for regulation of naturopathic medicine. I am for that. I am for proper licensing, for proper exams, and for ensuring that some of the quackery that I mentioned to you is taken out of this practice. That's my challenge to you. I disagree with introducing naturopathy as primary care medicine as it stands today. I think that there's just not enough evidence for too many of the modalities. What we need is better controls, better regulations. I don't want to throw out the baby with the bathwater, because there are very good things that we can learn from naturopaths. However, I think there are too many skeletons in the closet. We need the evidence. We need to be evaluated. And when the evidence comes, we in the scientific community will gladly embrace it. Nobody has a monopoly on the truth. Science-based medicine may not always work, but in my view, that's the way to bet. Thank you.
A passionate defense of science, a passionate defense of evidence, and throwing hot water on cold socks. Joe Schwarcz, thank you very much.